just introduce for us our next panelist, and then hopefully we can come back to it later on.
All right, thank you, Mr. Wale. I bet technical issues. All right, moving forward, the second panelist that we have here is Mrs. Adenike Oyetunde Lawal. Adenike Oyetunde Lawal is a lawyer, a qualified alternate dispute resolutor. She is a qualified human resource personnel, an emotional intelligence coach, and holds a diploma in special needs education. She has earned several certifications and holds a diploma in special needs education. She has earned several certifications in understanding of ADHD from the University of Derby. She was nominated from several media awards, winning some and getting other recognition on the job as a multimedia personality. In 2017, Adenike was a speaker at TEDx Bagada, Lagos, speaking on philanthropy and the role of empathy in the human society. Her passion, driving Amputees United initiative, a special group specifically for amputees. Her work has earned her several platforms, spanning for hosting events, moderating several sessions, and being part of conversations around the plight of disability in Nigeria, led to establishing the many panels. She is confident, outspoken, and selfless. She was the senior special assistant to the Lagos State Governor Babajide Sanwo-Olu on persons with disability. After seeing her commendable work as the SSA in December 2024, she was appointed as the General Manager, Lagos State Office of Disability Affairs, LASODA, where she is currently working on the rights of people with disability. A goalkeeper, Bill and Melinda Gates Foundation, using advocacy to push for and encourage the inclusion for persons living with disability in her country, Nigeria. Adenike is vocal about having an inclusive state and society. She fights for the rights. So let me take it again. She fights for the rights of people with disability. She is an author of a self-titled memo, Adenike. Over to you, Mr. Wale.
Thank you very much for that. Ms. Oyetunde, are you there? You are muted. If you will unmute, thank you.
I'm here. Good afternoon. Oyetunde.
Thank you very much, Ms. Oyetunde, for joining us. So we have also maybe just a few minutes to get you to chime in on this topic. Happy World Down Syndrome Day to you. Where would you like to start? Maybe I should just allow you to share a few thoughts on this topic.
Very quickly, because we don't have a lot of time, I want to specifically applaud, commend, and thank Mrs. Modi, who has been an neighbor to me in the true sense of the word, and has continued to support in terms of collaboration, opinions, advices, either in my capacity as a general manager now, or whilst I was a senior special assistant, though we met many years ago. I would like to thank the entire team who put this together. I would like to say thank you for it, and to also expose you to the realities that we have a whole lot of work to do. Thank you so much. And I'll get straight to the conversation. And I know that I was supposed to touch on challenges and the concerns relating to accessibility and disability inclusion in the employment space. And I'd like to be very relatable. I'd like to be very relatable with the discourse. Before I became general manager, I had, through the help of one particular nonprofit, successfully put one person into sustained employment. By that, I mean, the person had been interviewed and then the person had been able to retain their employer. Now that I'm on this side of the divide, there's this nonprofit that's also trying to work with the agency in ensuring that we equip our PWDs who are employable. And by that, I mean they have gone to school to get the education. And unfortunately, when we see the CVs, for instance, it's very deflatorry, the depth of what is written in the curriculum vitae of many PWDs who are seeking employment. And even for the ones who have very well put together CVs, just a handful of them are better able to retain the jobs. So, and the average person's perspective is usually, oh, maybe the place of employee is not accessible, they are not inclusive. Might I state here that quite a number of the people who come to us to, with the intent of employing persons with disability actually do have spaces that are infrastructurally adaptable for persons with various forms of disabilities. But what we have found in practice is, unfortunately, many persons with disability are not able to retain their jobs for several factors. Factors that span from very realistic commute, factors that span from exposure to stress. The stressors increase once they get on the job. And many of them, unfortunately, who have pre-existing conditions now start to find themselves visiting the hospital a lot more. And these employers are only very considerate for a while, because as most of us will know, when you get employment in the corporate space, there's usually a probation period, and after which you are now confirmed as a full staff in many organizations. For the ones who themselves have multiple disabilities, just a handful of them are able to continue in terms of the commute. Either their caregivers are dropping them off or they're having to pay for cab. And you would agree with me that the cost of petrol in the past 6-8 months has been something. So this nonprofit that is working with the agency, we're actually brainstorming. We are in the ideation stage of how we can break even in that area. What can we do in ensuring that not only do our PWDs beat their chest to say, oh, I have gone to school. Going to school is one thing, but being employable is another thing. And because we are now exposing different forms of employers to the varying degrees of disabilities that exist, the parameters that people need to meet when they are seeking this employ differs from person to person. And I state this emphatically, so one person doesn't believe that, oh, if you have to be very vocal and maybe you're a stutterer, stammerer, for instance, the employer knows. So sometimes in those cases, even though you have to speak, they have more tests in terms of the intellect, and quite a number of them have to type. One person who has, however, done excellently well on the job, the employer has actually, I beg your pardon, the nonprofit who helped to place the person in employment literally sent me a very long message thanking me because and stating emphatically that in their many years of trying to fix PWDs into paid employment, this person has been remarkable on the job and has done such an excellent job that nobody who has taken the capacity even before he got on the job, especially for those who do not have disabilities, nobody has been able to excel profoundly. And I know that it was just one of many stories. And but he left such an indelible mark in my heart, because what he then meant was, yes, this young man had gotten an education different from what he was practicing on the job, but has, held out himself to being excellent and then sold himself as being excellent and the best fit for the job, got the job and, stepped into the room and he's consistently killing it and doing so well. And so when we speak to the realities of the challenges of a paid employment, one of the other challenges is some employers who have infrastructural adaptable spaces, have to be encouraged in terms of rebates of sorts. I know that the former administration was working with something of that sort, but we haven't revisited that conversation. I'm not going to sit here and start to lie to you. We haven't revisited that conversation, but it's a conversation that will come up very soon, because what we're trying to also do is to encourage would-be employers to see how we can encourage them to take more persons with disability in their employ. So when they take more persons with disability in their employ, the government will be able to see where we can meet them, where we can support them. Things as little and simple as adaptable, laptops. As simplistic as it may sound, especially in the face of the economy, I'll be honest in telling you that the prices have doubled. And so if we're able to give a rebate of sort here and there and just find a way where employers can open spaces, you see that more PWDs will get in the space. The MTN Foundation, for instance, has consistently continued to engage our PWDs who are employable and have passed the screenings, and have placed them successfully in paid employment for many years now. So they're more, what they're now trying to do is to look at ways that they can actually start to re-echo the successes that PWDs in the places that they have placed them are doing, so that it encourages other employers to be to come on board. I think that touches on the subject matter of employment and of the challenges as is with PWDs. I'd also like to touch on the role that the agency is playing in creating an inclusive environment. Awareness and education cannot go without a lot of emphasis, but without touching on the emphasis, one needs to also touch on what the issues that we've identified: stereotypes, myths. We've also touched on and identified culture and religion. And to be honest, the subject matter, is particularly the last two, are so enormous that except and until every single hand is on deck when we're talking about how to break the cultural beliefs and religious practices that surrounds the stereotypical mentalities that the average Nigerian has when it comes to Down syndrome, is almost near impossible, especially because of the nature of the challenges that a state like Lagos faces. I'll give you another very typical example. Lagos State, like New York or Florida, is inundated with migration concerns. So there are various forms of disabilities, and there's a particular class of disability that when you sit down and you informally take note, you find out that some of them are from a specific part of the country. Now, what the state government is trying to do now, low-key, is trying to find out how we reach these people. But the danger of doing that is that once that is, we are not just packed in the hearts of those that are back home, wherever it is that they are. Because from our findings, we realize that once we are able to pick up 1 or 2 or 3 or 4 of them, or even 10 of them off the streets, guess what? In a space of 6 months, there's an influx. So Lagos is currently inundated with a migration crisis that is speaking very loudly, even in the disability discourse. Unfortunately, we're still trying, to find out how we can mitigate that whole era. But concerns of stereotypes is why conversations of this nature, as much I know that it's very interesting and very great for us to have conversations that are this deep. But what I have now found out in practice and in principle is that it's time for us to take these conversations to the places where they will be amplified. And by that, I mean the woman who's by the sides of the road who has had a child now with Down syndrome, or has a grandchild with Down syndrome, but doesn't know what it means. You find out from such families that people walk up to them and then encourage them to give their children things like to kill their children, actually, to poison their children, to give their children wrong things so that they can die.
Right.
And the ones that are not poisoned, you see that they find, some of them encourage them, or you can sell your child for money rituals. So the next phase of what it is we're trying to work on is we're trying to work on advocacy and awareness kit tools that we can then finally push into the public space, so that every time you probably turn on your television or your radio, or you look here and there, you begin to have conversations about disability, people with special needs, and more specifically people with neurological or intellectual concerns. I know that there's a time, it's just trying to lump
No,
everything
that was
together.
really insightful. Thank you very much. A very quick question, if you can just speak to this.
Sure.
Clearly, it's a challenge for society, just changing stereotypes and even being informed. When you were speaking to employers rather, I wanted to get your perspective on the smart thinking that can come around, what has happened post-COVID, where working from home and remote working has now become a thing. Potentially, I imagine that this could offer a new opportunity for more companies to take on people with disabilities. I was wondering if that is something you're exploring in terms of the advocacy and the engagement.
As for instance, you will see that the work from home scheduling has completely died in most places. So at the point, in fact, the young man I speak of got his job, I think.
So sorry to jump in. I apologize. Maybe in some places, but I think it's really mixed. In fact, what I see in most parts of the world, in many places, including Nigeria, actually, is where they allow people to have maybe even 1 or 2 days to work from home and so forth. So
working from home 1 or 2 days is not, I don't even think is in dispute, but working from home as you had painted it in terms of the realities of what COVID, gave to us, where most of the days we were working were from home as against being in the office. is not what is not is the practice.
Of course, everyone,
A very
there's
simple
a move
example.
back into the office, I know.
Exactly. People have
But
moved back
I
to
think
site.
there's now been a mix, some kind of hybrid model. But
I think you
I
should
just
start
wanted
to
you to
I think
speak
you
to
should
what
start to
that whole
investigate,
culture
because
has opened up.
you realize that we can't push how do I put it? The global corporate culture is one that, unfortunately, as with most parts of as with most things here, we play catch up. So until conversations one are had where the value of the would be PWD in terms of what they bring on board is shown to the employer, where they know that this person has so much value. And sadly, until one person either believes in what you are saying, even before engaging you, or has engaged you in a little capacity or small capacity, you can't sell who it is that you are or what it is you can bring on board. I'll give a typical example. In Lagos State, for instance, I think at the start of this month, the governor simply said it. Civil servants, grade level 0 to 14, 13 can actually work 2 days from home now, and then other levels just a day from home. So it means that when you go into the secretariat, there's a staggered presence of individuals or staff as the case is. Now, what that then portends is that if there are like 2 or 3 people who are currently in the process of being gainfully employed, and the nature of the job description of these 2 individuals requires that they have to be on premises on site as against being at home. So now it's more about our conversing with the employers as to what creating a structure where some of these job descriptions would encourage, to a very large extent, like you rightly mentioned, the hybrid structure, where if you have a job role and 2 people can adequately fit into doing it, one person might actually be more on site and the other person actually creating a hybrid system,
Right.
which we have seen. I have personally seen it play out in some places. But with the government practice as is today, that is what is happening. And we're hoping that as conversations and opportunities of this nature continue to present itself, we're better able to say, our people can provide the services that you need. However, you also have to accommodate us and adapt to the realities, knowing full well that we are bringing value to your business, because at the end of the day, every business person wants to make money.
No doubt. Thank you very much for that. And we'll certainly dig into some of these issues again as we proceed with the event. I just want to also acknowledge the DSFN students and staff that are joining us. I see you. And everyone else that is joining us from across the world, you're all welcome to this very engaging conversation. I hope it's enlightening so far. I'd like to now go back to Ruth. Ruth, unfortunately, we lost you at some point. So I'd just like to give you a few more minutes to perhaps share your experience as a parent. You probably heard a few things from Adenike as she was sharing her perspective about how employers are dealing with this issue. I imagine there is a wide range of experiences you can share. Can you just speak to us for a few minutes? Okay, I think unfortunately we've unable to connect back to Ruth. I did see her jump back in a minute ago. Okay, so on that note, I'd like to yield back to Precious now. Perhaps we can go on to invite our next speaker.
Yes, thank you very much, Mr. Wale. And thank you, Mrs. Adenike, for doing justice to that segment. We really appreciate it. Okay, moving forward, we have the next person is Nathan Rowe. In his role as Program Director of Down Syndrome International, Nathan leads on program strategy, ensuring high-quality projects and advocacy. Nathan has an MA in Disability and Global Development from the University of Leeds. He had a sister with an intellectual disability called IC, and is passionate about making the world more inclusive for people with disabilities. Over to you, Mr. Nathan.
Okay, Precious, I'm going to have to come right back to you because unfortunately Nathan hasn't joined us just yet. Perhaps
I'm on here.
Oh, you are? Oh, great.
I'm here.
Apologize.
Welcome.
I thought we did.
Can you see me?
Yes,
Yeah,
we
just
can.
now,
We
yeah.
can. Absolutely.
Great.
Okay, great to have you. Okay,
Thank
please.
you. Thank you for the
Take
introduction.
it away. Maybe you want to share your perspective on this topic. Go right ahead.
Okay, wonderful. Thank you very much for inviting me to speak to you today. It's a real pleasure to be with you and with such a great group of speakers. and nice to see students and staff from the organization too. Hi, everybody. So happy World Down Syndrome Day, everyone. I wanted to just share a little bit today about the campaign that Down Syndrome International is doing about health equity. So I have got a few slides. I can share my screen if that's okay with everybody. Let me just try and...
Yes,
oh,
I think that should be fine. Can we allow him share his screen, please?
Just...
right. Do you perhaps want to get
I'm not sure if I'm allowed to share, but
hopefully we'll
oh, here
get
we go.
this fixed.
I can
Okay.
do it. I can do it now.
You can do it now?
Yeah.
Wonderful. Yes,
So,
I can see it. Please go ahead.
thank you. So hopefully you can see my screen.
Yes.
Okay. So just to give you a bit of background about Down Syndrome International.
Yeah, go ahead.
So we are the global network of people with Down syndrome and their families, and we have 160 member organizations in over 140 countries around the world, including, of course, Down Syndrome Foundation Nigeria, which is one of our very active and excellent members. So just get a bit of background on what health is. So the World Health Organization says health is a state of complete physical, mental, and social well-being, not merely the absence of disease or sickness. So it's really important that we remember that health is not just not being sick, and that actually people can be healthy even if they have an impairment or a condition like Down syndrome. So people with disabilities can be healthy. And also that people with disabilities have healthcare needs beyond their impairment or condition, just like everybody else. So we all, I'm sure, know what we need to be healthy. So things like good food, exercise, water, information, being able to go to the doctor, having supportive family and friends and community, and being able to participate in our communities. And health is obviously important so that we can participate in society, and everybody has a right to health. All people deserve to be as healthy as possible. So something that happened in the last couple of years, the World Health Organization published a report on health equity for people with disabilities around the world. And this covers what health equity means, levels of health equity in different countries, factors that cause health inequity, and things that can be done to improve it. So just a little bit of background about what health equity means. So health equity is when people with disabilities have access to quality healthcare that meets their needs. So if there's no access, that leads to poor health, but equally if there's poor or bad quality care, that leads to poor health. So access plus good quality care that meets your needs equals health equity. And just a bit of a point about the difference between equality and equity. So equality is about having the same resources or opportunities. And if you look at the picture on the left, everybody is given the same resource, the box to stand on to watch the game. But actually, one person cannot see the game. So equity is actually about making sure everyone has fair outcomes and distributing resources so that things are fair. So as an example, if we're talking about getting a bus and the price is the same for everybody, that might be equal, but actually it might lead to unfair outcomes if some people can afford to take the bus and some people can't afford to take the bus. So it wouldn't be equity. And similarly with the doctor, if the doctor doesn't explain things in a way that everybody can understand and that is accessible, then that might be equal in terms of how they treat people, but we don't have equity of outcomes because some patients cannot access the healthcare they need. They can't communicate with the doctor like everybody else. In the World Health Organization report, there was a lot of evidence from around the world that people with disabilities do not have health equity. So people with disabilities die younger than other people. People with disabilities have higher rates of different physical and mental health conditions. And people also have worse functioning. They're not able to do the activities that other people can do. So we won't do a question. I know we're short on time, but the report also highlights a lot of the causes of the factors that cause health inequity. And a lot of these were caused by unfair, unjust, and avoidable situations which affect people with disabilities more than everybody else. So, for example, there can be things like structural factors, so like stigma and discrimination, and the stereotypes that I'm sure we've been talking about today. Also things like inadequate policies and processes. We know people with disabilities are more likely to live in poverty, and often transport to healthcare is not accessible, which makes it even more difficult to be healthy. There was a lot of evidence that people with disabilities are more likely to be inactive physically and to have poor diets, which also leads to poor health. And another really big issue is poorly trained health professionals, maybe who don't understand how to communicate with someone with Down syndrome, or to give inclusive and accessible healthcare services. So what can be done? So these are some of the things we can do to improve health systems. So by improving health systems, we can improve people's health. So if we have health systems that provide the health services people with disabilities need, if there are low or no barriers to people with disabilities accessing these services, and if health professionals provide quality care for all, this is a really these are big steps we can take to make health equity, health fairer for people with disabilities. And in the World Health Organization report, there were 40 recommendations for governments on steps they can take to make health equity happen. So make healthcare better for people with disabilities and fairer. So I know it would be worth going and having a look at those recommendations if you haven't already. One of the really key ones is involving people with disabilities, including their representative organizations. So organizations like the Down Syndrome Foundation Nigeria should have a really key role in making health better in their countries. And finally, just to wrap up, the World Health Organization is currently working on a disability guide for action. And this is something that will support ministries of health to advance health equity for persons with disabilities by prioritizing entry points and contextualizing the recommended actions from the global report. So this is mainly aimed at ministries of health and government, but the process should engage with other ministries and stakeholders, including civil society partners. So organizations like the foundation should be involved in this process. And they've started with a few pilot countries, and I attended a meeting on Tuesday with the World Health Organization, and they said they're currently in conversations with the Ministry of Health in Nigeria to start one of these processes. So I think this is a really fantastic opportunity for everybody to get involved in the process and have their say in making healthcare better in Nigeria, and making sure people with Down syndrome can access the healthcare they need to live healthy lives, which means they can be a part of their communities and society. So that is the end of my presentation. Thank you so much for having me along, and I look forward to hearing everyone else's presentation, and I wish you a very happy World Down Syndrome Day.
Thank you very much, Nathan. A very insightful presentation. I hope you will stick around, because I think potentially we may have some questions from our participants. We would love to have you speak to that. In fact, if I can just throw one at you right now, I do have one coming to me. What are the global challenges in dismantling stereotypes surrounding the abilities of individuals with Down syndrome? Can you just highlight very briefly for us from your experience, the big challenges there?
Yeah, certainly. I think there's a lot of I think there's more needs to be done, I think, to think whose responsibility it is to dismantle stereotypes. So
Mm.
I think often the responsibility falls on organizations like Down Syndrome Foundation Nigeria and Down Syndrome International, and we are doing our best to make a difference and to challenge these stereotypes, but we can't do it on our own. And I think that's really important that that other organizations help out and that there's more people joining the campaign to end the stereotypes, because we can't, civil society and small organizations, we can't do it by ourselves.
Right.
So I think that's one of the big challenges. We need help. We need businesses involved. We need governments involved. We need the UN
Philanthropists, I
involved.
imagine.
Yeah.
Right. So more spokespeople, if you like, for these causes. Thank you very much, Nathan. We certainly would, I imagine, have more questions for you, but as we move on with the program, I'd like to now try again to get back to Ruth to share her perspective as a parent. Ruth, if you can hear me, we would love to hear you now. My apologies for the connection challenges we've had so far, but please go ahead for a few minutes.
Okay, thank you so much, Wale. You're doing a great job. Thank you so much. Okay, like I was saying, I think we the parents are usually on the receiving end when it comes to these stereotypes. My child was not just born with Down syndrome. He had cataract in his left eye. You know, when the second speaker she mentioned, you know, children with multiple conditions. He has Down syndrome, and he had cataract of his eyes. And I remember when we were going to one of the hospitals in Lagos State here, we were usually relegated to the background, right? I usually get to the hospital before 6 a.m. And because they don't have this language to communicate with these children, right? They keep us, you know, in a very tight corner. They say, stay there until we get someone to attend to you. And for goodness sakes, for someone that came into the hospital before 6 a.m. and at 4 p.m. you are still in the hospital because no one understands how to communicate with this child. I mean, for somebody that has an eye issue, you know, there will be refraction, there will be other, you know, tests to be carried out. Each time we go to the hospital, before I abandoned that hospital, it was from morning till evening. We take our breakfast there, we take our lunch there, and we're almost taking our dinner even in the hospital premises. I can go on and on. I went to another clinic. He was having pressures in his eye. He was diagnosed with glaucoma again after several years. And this hospital boldly wrote on his file, patient did not cooperate, because they don't have the language to communicate with these children. When we go out, maybe to church, you know, people want to now form like a pity party around him, and I try to challenge that. I mean, he doesn't have he's not leprous, even if he is. He's a human just like you and I. So I ward off such people. I even fight if it comes to the, you know, to that level. Please don't look at my child like that. Don't talk to my child like that, because it is how I present my child that the society will take him. If I hide my child, they are going to relegate him to the background. But if I bring my child and I present him as a human first, before his disability, people out there, whether in the society, whether at home, whether in church, even some of the carers don't even have these capabilities to relate with these children. And so these stereotypes, I can tell you that I will be in the forefront if there's any campaign whatsoever. I will take the lead, because I have seen what has been done to my child. I did a post this morning about being a special needs mom. Of course, I would fight anyone for my child's sake. Being a special needs mom does not make them lower or lesser than their peers. We have other children that are regular. So the society should not think that, you know, this is the only child we have and that's how it should be, or that's how it can be. No, we have other children that are regular that help these other ones to achieve their milestones as time goes on. So they should stop relegating us to the background. That is what we are fighting for. That is what we are speaking up against. That is what I think the government, I don't know of anywhere else in Nigeria, but in Lagos State, thumbs up to Mr. Denike. I met her last year in October while she spoke at the program in the local government in Agege. I think more needs to be done. Trust me when I say, when I was inviting people for this program, a lot of people still don't know what Down syndrome is all about. A lot of people still look at us in that weird old look, a yeah look. You get what I mean? So we need to stop this stereotype, and we'll stop it right now. Thank you.
Thank you very much, and really appreciate your contribution there. If I can go very quickly to Nathan, before we get to our other speakers and our next presentation. Nathan, can you just speak very briefly to the opportunities that potentially telemedicine and so forth is giving, where we can find the collaboration locally with specialists abroad to offer this treatment and training to medical practitioners and support to those who unfortunately may not be best equipped to handle people with disabilities? Are there opportunities for that?
Yeah, I think there's opportunities if training is needed. There are lots of people around the world who can provide training, and I think training is really important to address those issues where healthcare professionals are not providing treatment properly because they see someone with Down syndrome, they don't know how to communicate with them, as Ruth was describing, and they you know, they don't diagnose issues properly. So yeah, there's definitely opportunities for that. I think it has to be driven by the Ministry of Health and to be happen on a scale that's really going to make a difference. And I think it's also really important that health services for people with Down syndrome are not seen as a specialist thing, that actually all health services need to be inclusive so that a person with Down syndrome can go to their hospital near them, the clinic near them. It's not a, you know, one place in the whole country that you can go to. Otherwise, it's, you know, Nigeria is huge, and it means most of the people will not be able to access healthcare if we don't make it about the whole healthcare system being more inclusive.
Understood. Well, thank you very much, Nathan, for that. And thank you to our speakers so far. Hopefully, we will get more contributions from you as we proceed. But for now, I would yield back to Precious to introduce our next presentation or performance.
Thank you very much, Mr. Wale, for that. Thank you so much to our first panelist, and thank you for that first session. It has been enlightening. So moving on, the next item we have here is to introduce the self-advocate. We'll be yielding back to Mr. Innocent Okro, the Deputy Head of Education. Afterwards, we'll be having a break, a little performance and recitation by the students. Please, we have 5 minutes to do that. Over to you, Mr. Innocent. Mr. Innocent, are you there?
Yes, good afternoon, everybody. So the section we're in right now is for the self-advocates to do their performance. And to do that, I will be introducing the set of self-advocates that will be participating in this first section. And the first on the list is Foluke Dorati. Foluke Dorati is a young adult with Down syndrome. She is a self-advocate that advocates for herself and for the rights of other persons with Down syndrome that could not speak for themselves. So Foluke, over to you for your presentation.
They should unmute their mic.
Can we unmute? Unfortunately, we cannot hear her right now. Can we unmute? Thank you.
So, mom, that is you will know everything, you must solve it. Yes, at least. I don't no one ever know who any.
Okay, thank you so much, Foluke. I think Foluke was having some issues with the network, so I will have Mr. William Stabi to quickly interpret what Foluke was trying to say for our other audience that could not hear clearly. So, Mr. Williams, over to you, please, for interpretation.
The shot is still muted. We cannot hear. We need to unmute, please. Yes, go ahead.
All that is trying to say is that we should embrace mission. Thank you. Next person. My name is William. Give me opportunity. Especially the it's not about them in that is what them being part of the world and thank you from this.
Okay, thank you, the self-advocate. This is the first presentation of the self-advocate. As we continue in the program, the second set will also come for their presentation. Thank you so much. Over to you, Precious.
Thank you so much, Mr. Innocent, for that session. And thank you so much, Down syndrome students, for that performance, even though network providers need to be sued for not giving you enough. We couldn't actually hear the amazing thing that you wanted to render unto us. Okay, moving forward, we have the next panel sessions. But the first on our list is Mr. Abdullahi Usman Aliyu. I hope he is with us. All right, a brief biography of Mr. Abdullahi Usman Aliyu. Mr. Abdullahi Usman Aliyu is a disability advocate with over 20 years of experiences in the disability rights movement. Abdullahi currently serves as the national president for the Joint National Association of Persons with Disabilities in Nigeria, the umbrella organization of persons with disabilities in Nigeria. He is also the public Relations Officer, PRO, for the West African Federation of Disabled. Please, can you kindly put it on the screen so that people can also read with me? Moving on, and a permanent delegate of the Commonwealth Disabled People's Forum. Before now, Abdullahi has been engaged in the services and activities of persons with disabilities. In Nigeria as executive chairperson and member at both state and national levels. His cross-sectoral experience includes, but not limited to, strengthening grassroots organizations and movements led by organizations of persons with disabilities, organizations for persons with disabilities, and other disability inclusion enablers who are involved in advancing the rights of persons with disabilities in inclusive development agenda. He is equally very skilled in providing strategic leadership on lobbying, policy design and implementation, and monitoring social interventions within private, public, and development sectors. As the current national president of the umbrella organizations in Nigeria, Abdullahi serves to promote unity and development agenda amongst the disability communities and diversities, which are widely spread across the 36 states and the Federal Capital Territory. You're welcome on board, Mr. Abdullahi. So over to you, Mr. Wole, to take this panel session.
Thank you very much. So, Mr. Liu, I hope you are with us. I just want to give you about 6 minutes or so to share your thoughts on the efforts of your organization as an advocacy group. Mr. Liu, are you here? All right. I think, unfortunately, we may have lost a connection with him. And so we may have to move on to our next panelist. Hopefully we can reconnect and have him join us. But before that, perhaps if Mrs. Oyetunde Lawal is still with us, I do understand that you may need to drop off shortly. I was wondering if you could speak very briefly to a couple of points that I think have come up. Okay. So I'll give you just about a minute to speak to this. One of our participants actually echoed the sentiment about the lack of skill with our healthcare professionals. And I was wondering if you could speak to the extent to which your organization is helping to address that issue.
Okay, so I would my style of leadership is transparency, so that, because what I realize is that quite often when we try to cover things up, there seems like there's a covering, on it, and people don't get the full picture. I'll give you a very simple example. We're currently having to handle a case with a young man who is with albinism and has skin cancer. And so for a few weeks and months, he had been going to a hospital and he had been prescribed antibiotics for so long. And because you know how delicate cancer care is, thankfully, the case got to one of the very best in dermatology in Lagos State, and who also has a passion for people with albinism. And the person jumped on it, and we are aggressively treating this young man. And I was so furious. I had so much rage in me. And, I was already thinking, who do we write to? Where do we go? Who do we report? Who do we do this? After all of that, the consultant dermatologist then, calmed me down and said, okay, so a better approach for us is for us to increase and intensify our education, especially for those of us in the health space. So there's so much that the agency can do, even if those even in the health space are not doing it, for themselves. And that whole trajectory took me on a sort of informal research where I then started to research medical negligence. And to my greatest surprise, I started to see numbers, in countries that, have the numbers. And then I realized that it's actually a big deal and a huge problem across the globe. The issue of misdiagnosis, underdiagnosis, wrong diagnosis, as well as medical negligence, especially when it comes to special needs care, more specifically with early childhood detection. So I believe that with the biggest children's hospital in Africa, under construction at Massey in Lagos Island, Mr. Governor has committed that there will be a huge early intervention department there. And our hope with special needs, more specifically with Down syndrome, unfortunately, is not something that can be treated. Like we all know, once you find out, you just know from even in utero that the child you're with, has this fascinating number of chromosomes. But what that would expose such a family to is, the on the spot, all hands on deck kind of care, where it is multi-sectoral and multidisciplinary at the early childhood the directorate that is coming up at the Massey Children's Hospital. And I know that without a doubt, one of the things that we're hoping that does holistically is to now amplify why there will be a need for us to replicate it either through government intervention or through PPP, because we're now seeing, even with cases like the cancer care area in Louth, that possibly the likelihood of partnering with private investors in providing health care might be a huge step in providing better care for the populace in Nigeria.
Thank you very much for sharing that story and your insights. Destiny, if we can move on to our next panelist, Professor Ajuwon, can you please briefly introduce him and so we can engage?
Yes, sure. Thank you so much, Mrs. Adenike. All right, Professor Paul Ajuwon currently works as an international consultant in Nigeria and the United States. His interests include teaching and research on issues that impact the education and rehabilitation of children and youth with disabilities, family quality of life, the impact of legislation on vulnerable populations, effects of inclusive education, personal preparation, and the use of assistive technology and Braille illiteracy. Over to you. Braille literacy, rather. Over to you, Mr. Wali.
Thank you very much, Precious. Professor John, it's a pleasure to have you join us from the United States. I'll give you about 10 minutes to share your perspective on 3 issues. The first, related to what we've spoken about up to now, is bridging the gap in communication between healthcare providers and families of individuals with Down syndrome. We'd like you to also touch briefly how we can address stereotypes relating to stigmatization and discrimination within the healthcare space, and also, lastly, training healthcare professionals to identify and manage the health challenges associated with Down syndrome. I've spoken to this point earlier. I would like to get your smart thinking around them. It's over to you, sir. You are muted. If you can unmute, sir. Okay, you are still muted, Professor Ajuwon. If you can turn on your camera as well. I did see him come up earlier. If you can hear me, Professor Ajuwon, if you can just unmute yourself and turn on your camera. Okay.
Can you see me?
Not
Hello?
yet. We can hear you, but
Oh
there
my
isn't
goodness.
a shot just yet. But we can hear you now.
You can hear me now, but unfortunately, you cannot see me, right?
And I did see you earlier. Unfortunately,
Oh,
we can't see you right now for some
oh
reason.
my goodness. Well,
Perhaps you could just switch on and switch off the camera if you can.
Are you able to manipulate the video from your end?
I would find out, but please go ahead. Please go ahead in the
Okay,
meantime.
I'm sorry. Well, I need to confess that to tell folks that I'm totally blind. So I thought I had this taken care of with the video.
It's okay, sir. We can
Okay,
hear you
all right.
clearly.
You can hear. Okay, thank you so much. And I really applaud the organizers, Mrs. Modi, and her fantastic team of support personnel at the Down Syndrome Foundation for this wonderful job, and for the eagerness for staging this event and other activities I'm sure will follow this week in Lagos, Nigeria. The previous speakers have really hit the nail on the head. They've tackled some of the important issues I was planning to touch on, and I'm not going to repeat most of what they've said because I think they've done a fantastic job in highlighting the challenges we are facing with Down syndrome and other disabilities in terms of healthcare services, proper healthcare services in Nigeria. I have done some research work in disability and in particular with Down syndrome. And Mrs. Modi has been very helpful in enabling me to access her facilities and talk to her staff. And I really appreciated her willingness to always participate with me and others that have an interest in Down syndrome and in the broad area of disability. I was specifically asked to talk about the issues the moderator mentioned, and I would like to focus on inclusivity in the health sector, which is very central to the well-being and societal integration of people with Down syndrome. What do we mean by embrace? I think that's a key concept to talk about. Simply defined, embrace means to accept someone or to accept something readily or gladly. So it is very important that we have that definition in mind. And in support of what it means to embrace, I'd like to tell you just quick
Mr. John, are you there, sir? Okay, since we have lost the audio to Professor Ajuan, are you still there, sir? Let me give him a second. Hopefully we can get him back. You are muted. Unfortunately, you are muted, sir. We are unable. Okay,
hello?
I think you're back now. You are back now.
Am I
yes.
back now? Okay.
Yes.
I don't know what happened. I think
it's okay.
This is the challenge with technology, especially long distance when you are thousands of miles apart. But in any case, I was saying that two situations that illustrate what it means to embrace. And this is what I identified with my colleagues that I know personally. While working at Obafemi Awolowo University some years back as a lecturer in special education, you know, an expatriate mother had an ugly experience with lack of embracing. And what happened is that this mother is a mother of a child. At that time, the child was 11 years old, a child with Down syndrome. This expatriate mother, working on the campus of Obafemi Awolowo University, Ilefe, loves her child very much, and she wouldn't leave him alone, and she would take him to places. She was very passionate about giving the child the support that she needs, just as the parent from First Start was talking about earlier on. And so this mother went to the healthcare center of the campus, the healthcare center is located on the campus, and went and took her child, the child with DS. And, as you know, self-talk, when people talk to themselves, is a common characteristic of some children with DS. And that which caught the attention of the nurse, and the nurse is the frontline staff you see at any healthcare center. And this nurse had the guts to talk to the mother to say, why don't you leave the child at home instead of bringing her to a public place like the health center on campus, and having that child behaving to her in a quote unquote bizarre way, because the child was self-talking and obviously had features of Down syndrome, and found that it wasn't befitting of the mother to take the child, and she concluded that the child was ridiculing the mother that way. Well, you know how hurtful that kind of reaction would be. Well, the mother obviously was devastated by that remark from the nurse. And I'm not going to tell you what followed suit, because she followed up with the university authority. Now, this was on a campus, on a health center at a campus in Ife. A similar incident happened in Plateau State when I was there, similar to this, but this was in a primary healthcare in Jos, actually, in Plateau State. And fortunately, the mother, like the parent we have from First Start, could not tolerate the insult from the healthcare frontline staff, who questioned why the mother should come to the center, because according to the frontline staff, that center did not have the specialists or the capacity to treat the child. Well, I'm narrating these situations just to show you the huge task that we have on our hands in terms of inclusive healthcare in Nigeria generally, not only for children and youth with Down syndrome, but for all disability groups. Now, the fortunate thing is that we talk of brain drain. Our nurses and our physicians in Nigeria who are fleeing en masse, in the United States here where I work, and in Canada where I used to live, and I know from Australia and UK where we have friends and where I go to visit, we have thousands of physicians and nurses from Nigeria who are ironically doing very well and on the job there. They are practicing best practices in inclusive healthcare in these foreign countries. And I have often spoken to groups of Nigerian physicians and nurses, as well as other specific indigenous groups here. And, the question always comes up, why is it that we do not learn to do the proper thing when it comes to healthcare practices, especially for children and youth, and even with adults with disabilities when we are back home? But when we find ourselves in hospitals in Canada and the USA, UK, we are ranked amongst the best service providers. You know, I told you earlier that I'm blind, but I'm totally blind. I went to a school for the blind in Lagos, Pacheli School in Lagos, and went to 2 secondary schools in Lagos before coming to study in America. And now I'm back in America. And when I go to receive healthcare services, it's amazing how diligent these service providers are in the United States. So I think we have a lot to learn and to implement in terms of best health practices for
Right.
our marginalized marginalized populations in Nigeria.
Professor John, thank you.
Yes.
Thank you so much for sharing your perspective. We do have another speaker who is joining us from Canada, and I know it's really early over there. So I would actually like us to take him now, but I was wondering if you can, maybe in a minute, just round up with a few comments on this point.
Okay. Well, thank you. I know some of the speakers have mentioned a lot of what I was planning to say, but I think we have on the books one of the progressive laws related to all areas of disability, including healthcare. And if we begin to look closely at these laws, for instance, the Nigeria Discrimination Act of 2018, which the last president signed, there's paragraph 21 that clearly states free and appropriate healthcare for persons with disabilities. I think we need to consider the most effective way of implementing such policies so that we can deliver inclusive healthcare services for our marginalized populations. Thank you very much.
Thank you very much, Professor Juwon, for the insights, for sharing your experience, for telling us that story. And I believe that the message is going around. Hopefully, we can all come together to take this on and see how we can provide better services and, of course, inform and educate those who are responsible for taking care of people with disabilities, including Down syndrome. Apologies, I'm just looking at a short message being sent right now. Okay, so what we're going to do now is move on to our next speaker. So I'll invite Precious to introduce the background of our next speaker.
All right, thank you very much. Thank you so much, Professor Paul. We also have another professor who is on standby to take us through another panelist session. Please stay with us. Okay, Roy Brown.
Yes.
Roy Brown.
Well, I'm so sorry, Precious. We'll be taking Professor Brown after later on. Let's stay with the initial plan. If you do, let's have Dr. Wako.
Okay.
Yes.
All right. All right. So we have Princess Christiana Nwankwo. Princess is the second of 8 children in the home of Professor Obi Nleredim and Mrs. Comfort Brown, both of Nigerian descent. Princess was born while her late father, Professor Brown, was only a student at University of Glasgow in United Kingdom, growing up in a home which had both parents as university lecturers and which was run as a university with departments and faculties. Was fun and exciting. Everyone had a role with a distinguished title as is found in universities. In the home, while the father chose to be called VC, short for Vice Chancellor, the mother was naturally called DVC, Deputy Vice Chancellor, as her role was imagined to be that of deputizing the VC. The first child, a female, was called DOF, a short form of Dino family, and Princess, the second child, was fondly called DOGO, Dogo, short form for Director of Girls Only, but also for reasons that she grew taller than everyone in the house in her early teenage years. And the word Dogo literally means tall in Hausa language, which every member of the family also understood. Funny indeed, expectation of good grades was a rule for every child in the house. Luckily, Princess excelled at all levels in her schooling. She had a Bachelor of Science degree holder in pure and industrial chemistry with second class upper division from the University of Nigeria, Nsukka, 1991. She holds a postgraduate diploma degree in petroleum engineering with distinction from University of Benin, Benin City, 1997. An excellent Master of Science degree in petroleum engineering from University of Ibadan, Ibadan, 2003, and a PhD in petroleum and natural gas engineering from Penn State University, USA, 2005. Princess is married to engineer Kenichi Nwankwo from Anambra State, who is the convener and chairman of the Down Syndrome Parents Forum in Ibadan, Nigeria, and together they have 4 adorable children, and one of whom is a person living with Down syndrome. She is a strong advocate for persons living with Down syndrome. You're welcome, Dr. Princess Christiana Nwankwo.
Thank you.
Thank you very much. I want to say hello to everybody. This has been an interesting session, and I've been following through with everybody else. Thank you for having me on. I want to say thank you and congratulations to Chief Mrs. Rose Mordi, who's been someone who is setting a pace that we must follow. And I'm glad she's leaving a heritage that will outlive her. Thank you, our panelists that spoke before me. Thank you for the moderator also. You're doing a great job. Yes, I'm Dr. Princess Nwankwo, a petroleum engineer who is a lecturer at University of Ibadan. I'm also passionate about issues on Down syndrome because I have a son living with Down syndrome, and thankfully he's doing very well. I'm challenged today to speak on breaking stereotypes from the perspective of a parent. You may share my slides, please. Now, first we want to talk about what's stereotype. These are a set of mindsets that some people have about a different set of people that they decide, even if it is statistically correct, that means there might be some truth in it, but it is not universally valid. I'll give you an example. So you can say all Black people are corrupt. Well, it is possible and is statistically proven that there might have been some Black leaders who are corrupt, but that doesn't make it universally correct to say that all Blacks or all Black leaders are corrupt. So those are what stereotypes are. And we need to stand up as advocates to correct what's wrong when we hear them. When you hear that Blacks can never make good leaders, Blacks can never learn anything great, Blacks can never invent anything, you want to stand up and show the difference and say, oh, you cannot make such overwhelming blanket of a statement. There are exceptions to such things. And so when it comes to children with Down syndrome or persons living with Down syndrome, what are some of the stereotypes we encounter? Some of these include that children with Down syndrome do not have, it's somebody's fault that a parent gave to a child with Down syndrome. With Down syndrome, those were one of the things that came to my mind. Could it be I didn't pray hard enough before I conceived the baby? Could it be I didn't do something right? I didn't have the stay with my husband in a bright room or in a dark room? Or is there someone who is angry with me who did something or say something to make sure that my child doesn't come out typical outside? But the right thing to say is that it's nobody's fault. It's God having his way. God chooses to bring us here as male or female, as typical kids or Down syndrome kids. And perhaps when we finally meet with God, we can ask him why. And so there are just and we must love them as such. We must give them same privileges as other typical children. It's nobody's fault. It's not your fault. It's not your husband's fault. It's not God's fault either. God just chose that, and we can't question God. The second stereotype I identified is that some people will say they are not like us. They don't have emotions. They don't have empathy. And so some parents choose to keep their kids maybe locked up in a room because you don't want the visitors to see the child, because you think, oh, the visitor is going to judge me by the looks of my son or my daughter who has Down syndrome, and the visitor is going to have a wrong perception of the setup of the family. So you don't let the kids come out when the visitor is there. You don't let the kids go to school when others are going to school. You put the kids inside and lock them in. You don't let them socialize properly. So this is not right. These kids have emotions. They have empathy. They can play. Every child it's my son with Down syndrome that will first greet and come out to the door to see who the visitor is and to welcome you. And it's okay with us. If you accept me, and you must accept every member of my family. And that makes my son very proud when he sees the visitors take to liking him. They want to shake hands with him. So we should never hide them. We should never feel ashamed of them. Another stereotype is that people believe they can't learn as hard or as well as the typical children. Well, there is some truth to that, because they are slow learners. They're slow learners, and they need a lot of maybe demonstration. And usually you want to start early. So it doesn't make it absolutely correct to say that they can't learn anything. They are not blockheads. Like the Nigerian language will say they are blockheads. They are not blockheads. If you start early, they call it early intervention. You start to teach them what you want them to learn from an early stage. Before they are 5, before they are 6, you are teaching them spellings, you're teaching them words, you're teaching them pronunciations. You don't hold back, you don't lower your language with them. I try not to. I found that I was someone who would want to use smaller sounding words or syllabic words without trying to use regular words that I would use with my other regular kids with him. But when I realized this was wrong, I speak to him like I speak to anyone else. And he's learned to understand me just like anyone else. And that's because I didn't limit his understanding. So if we start early, to teach them early, like I said, that's called early intervention, they will learn. Like, they might be slow, but with repetition and practice. Usually they learn better with practicals, things they can do with their hands. They don't just hear you and see you and take it like typical kids. They want you to demonstrate it. You have to demonstrate that 1 + 1 is 2, not just by saying it, as you would say with typical kids. And yes, they will learn, and they will do well with it. They will run with it. My son is doing very well at 8. He some technology, and he's doing well with it. So don't think they are blocked. Is that some people, one of the stereotypes is that exclude them from the society or from all the
We are struggling. It seems we're struggling with your connection, says Wako. Okay. Unfortunately, I think we are struggling to connect with Dr. Nwako now. All right, so hopefully we can have her join us again. But in the meantime, Precious, perhaps you could invite our last panelist, and then hopefully we can go back to Princess Nwako to finish her thoughts.
Can you hear me?
Okay, I think she's
yes,
back.
yes.
Can you hear me?
We can hear you now.
Yes,
you
I can
just
hear you.
speak.
Yes,
you can just round up in about a minute or two.
Yes, quickly.
Yes.
Yes. So I want to say they can be popular. And then I don't like parents to think, oh, my case is better or my case is worse. It's not nice for us to compare these kids with other kids, or maybe you're comparing the Down syndrome kids and you think, oh, this one is better or worse. I think the Holy Book says those who compare themselves with themselves are not wise. So I think what it's left for us to do is just advocate for them, do what's best for them, love them, give them the best we can, and speak up for them where the voice they have, where the legs they have, where the strength they do not have. And so we should advocate for them. We should speak up for them. We should be enthusiastic about what they will become. We should encourage them and walk them through the challenges of life. And yes, the sky would not be a limit. They will get there. Thank you.
Thank you very much. If you can give a very brief response to this question. Someone is asking, because you did mention about early intervention, and what would be your message to those who sadly didn't start early? What hope do they have? That's a question from one of our panelists, co-panelists.
Okay.
What will be your response?
Yes.
Very briefly, please.
Thank you for that question. Yes, usually the best practice. Can you hear me? Best practice is to start early, but no time is too late. It's better late than never. That's what I would say. Better late than never. If you just identified it, your child is already a teenager, but he hasn't learned his ABC or his 1, 2, 3. I think it's still okay to start when you can start. It's always better than not starting at all. Medical intervention, educational intervention, anytime you start is good, but it's better early. Thank you.
Thank you very much. Thank you very much for the insights you've provided in that short presentation. We would like to now move on to our next speaker, and I'll have Precious briefly introduce him.
Thank you so much, Mr. Wally. And thank you, Dr. Wanko, for that session. I was enlightened as well. I took note of some things. Inclusivity is important. Awareness in every sector is vital as well. And most importantly, we'll ask good questions about every other thing, about why they are like that. Thank you very much, ma'am, for that session. All right, moving next, our next panelist is Roy Brown. Born in England, is a clinical and educational psychologist who has carried out research and practice in the field of intellectual and developmental disabilities. He has worked in agencies and universities in the UK, Canada, and Australia. Currently, Professor Emeritus at Flinders University, Australia, and the University of Calgary, Canada. He holds, in addition, an adjunct professor appointment at the University of Victoria, BC, Canada. His research and practice has resulted in a wide range of books, chapters, and articles. In recent years, his major publications have been on quality of life and family quality of life across the lifespan. He has chaired the Quality of Life Special Interest Research Group of the International Association of the Scientific Study of Intellectual and Developmental Disability, LACID, and founding director of the LACID Academy, that provides workshops in many countries. He is an associate editor of several international journals. He currently consults to a variety of organizations in Canada, Australia, and Europe concerning research, including guidance and advice to doctoral students. He has been awarded the Order of the University of Calgary for his services to the university and Canada, nationally and internationally. He received the degree of Doctor Honoris Causa from the University of Great Belgium for scientific contributions to disability studies, and recently received the Dr. Robert E. Cook Lifetime Achievement Award from the American Academy of Developmental Medicine and Dentistry. He enjoys an active lifestyle, which includes family quality of life as father and grandfather, along the several leisure pursuits. You're welcome on board, Professor Roy.
Professor, it's great to have you join us. I do know it's really early in Canada where you're joining us from. Thank you for your time. I yield the stage to you now to share your thoughts on the topic.
Okay, can you hear me?
Yes, loud and clear.
Yes,
Please go
very
ahead.
well.
That's good. Then perhaps we could put up my first slide.
Yes, if we can, please put up Professor Roy's slides. Okay, they are coming up now.
Okay. Right, I will put these up. I won't read them all. I will make some comment, but I think this is a very important day, and it comes to us with a lot of history and lots of variation in different countries. I know that some of the things I may be saying may be difficult to do in a variety of countries, including yours country. But I think one of the most important things for people with Down syndrome is that they are enabled as far as possible to live a normal life in the community. And that means involving them in the community. And I know that can be a challenge. So one tries to get there as best as it possibly can. I have noted that if any of you want to get in touch with me, Nike Dennis has my email address, and I'll be happy to talk with you. I'm very grateful that I've been invited, and I would now like to go on to a variety more of my comments. And as I've said, it occurs in all countries. It has been difficult. When I started as a young man, remember I'm 90 years old at the moment. When I started as a young man, life expectancy for people with Down syndrome was short. It has now become much longer, but varies from country to country. The exciting thing is that having found some of the ways that some of the difficulties on health can be managed by our colleagues in the field of medicine, such as blockages that can happen for people with Down syndrome in their stomach or other parts of the body. We've moved to a time where we are getting involved socially in all the aspects of people with Down syndrome. So I've moved on to my slide. Sorry. As we all know, it's a genetic syndrome, and we know that it is difficult to be in a position to do this. I seem to have advanced my slides a little bit. Sorry, so could you put up my next slide, please? Yes, I put this up because I think it shows something very, very important. It's a piece of research we did several years ago, and it involves people with autism, that's the blue line, Down syndrome, which is the red line, and the control group is parents who have no child with a disability, but the same number of children in their home as in the other two samples. Now, if you follow the red line, you will notice there are major downturns in terms of need for people in Down syndrome. Item 2, which is financial well-being. There is, in many countries, not sufficient support for people to be able to function as a family in a reasonable way. You'll also see that item 4 is particularly low for people with ASD and very similar for people with Down syndrome. But if we look at the Down syndrome greens, the most important ones are item 2, financial, well-being in the family. They are also down for item 4, support from other people. and getting people with Down syndrome familiar with a wide range of people in the community is very important. Item 5, support from disability-related services. Many parents, these are parent responses, have got concerns in that area. Again, if we look at item 7, career and preparation for careers. Though people with Down syndrome are getting education in schools and regular schools in many countries, it is still very, very difficult for them to get a job in the community. That is beginning to occur. But it's very important that we provide them with opportunities and, as far as possible, a life in the community and the types of things that are happening. In my country at the present time, we are increasing the aides, people who are aides to help in school classrooms with people with disabilities. Another colleague of mine, Anne Hewson, has written a lot about the fact that people with Down syndrome can now attend university in some cases. But there are systems being set up whereby they may not take a course as such, but may be paired with someone who is taking a course, who is a student and is their mentor. This has proved to be very, very effective and has widened the social interests of the people with Down syndrome and their families. I haven't made a reference to this in writing, but I can send you a list and will do so. So you can contact the work that has been done. And excuse me, and of course that is leisure and enjoyment of life. Number 8 is higher in Down syndrome than autism spectrum disorder, but it's way below families that don't have children with disabilities. Of course, number 9, community and civil involvement. Civil involvement is a critical thing. And we found over the years working in this area that parents are very worried. Now, I will give you an example. Many years ago, I set up a program with colleagues to teach people with disabilities how to use the bus system. So we set up a series of experiences teamed up with a person who was working for the organization that I was the director. And we gave them opportunities with someone with them to wait at the correct bus stop, to get on the bus, to know when it is the right time to get off the bus, and so on. But a father said to me, I was so anxious about whether my child could get off the bus at the right spot that I decided to go with her. By the way, I should say, we always had, in the first areas of training when they were on the bus, we moved from having a partner with no disabilities to having someone they didn't know was on the bus. So they were on their own, but we were still taking care of them. But this father, who was a director on the board that I was in, followed his daughter in his car because he was quite concerned that she would never get off at the right place. But she did get off at the right place. And she turned and saw her father in the car. And Dad said to me, I've never been so embarrassed in all my life. I should have recognized that with proper training, my daughter with Down syndrome was capable of doing a wide range of things. Could I have the next slide, please? So here are some of the things that I think are relevant and important, and we've found that they have been of this type. They include the values in your society. We've got to see that there is a sensitizing concept. It must be person-centered, but it must also be family-centered. And many, many parents, as you all know, are under great stress and not certain what to do, or they are totally involved with their child with Down syndrome, that there are other stresses and strains that are going on. So the training centers we set up and the experiences aim not just at the person with Down syndrome, but the family itself as well. We should recognize something that's not been understood in many countries, that genetics is only one part of the situation. Environment is the other part, and environment affects the genes. So it's important, as I said earlier, that we provide as normal environment as possible. Some of the other things that I have really started to talk about, normalization is important. Having as normal a lifetime as possible, an experience as possible. But if you can't, try to simulate them in a way that ensures the person gets experience and knowledge. And then lead on to inclusion in the community as far as possible. Could you scroll down to the rest of my slide, please? Yes, so here are some of them. We want to build resilience in people, the ability of an individual due to an interaction of genetics and environment. Perception is a major driver of behavior. In other words, if the person with Down syndrome feels they're not competent, not able, or not allowed to do things they want to do, where we should enable this is important. And it's important for self-image because it can build a positive one. And so we should be carrying out something what you call empowerment, environments and opportunities for the individual to assert their rights and choices in decision-making, thus empowering themselves. For example, I had a young woman who worked in another agency, and she used to like to get tea, a cup of tea, at 4 o'clock in the afternoon. But staff said, oh, you can't do that because we don't have it at that time. But one of the things that was very important and was carried out in the end was that she was given access to the kitchen and helped to make herself a cup of tea. So she became independent. And in fact, that was a very successful case because with these supports, this young woman got herself a job to begin with, which she lost and came back to me and said, I can't do it. And I said, well, we will work together until you can. And in fact, in the end, she got her own job working in an organization, and she worked there in many, many years and earned very, very well. So personal control is something that we need to gradually develop because very often parents, people like myself, are in danger of taking control when in fact we should be helping the person to take control from themselves. And of course that varies between person and person. And then there's the item of inter and intrapersonal variability. Intravariability acknowledges the day-by-day variability shown by one person with implications for assessment, support, and intervention. And intervariability refers to the variability between people with the same diagnosis. But obviously, we want to expand the links in terms of a relationship with people in the normal community, in the regular community. And I did give an example of this, of where sometimes when people are doing well with Down syndrome, are paired up in a university with somebody who's taking a course. But eventually, it's been possible for some of these people to take university courses and have done for all of us, were surprised how well they could do. So really what I'm describing is a gradual build up of possibilities, of opportunities. And that means bringing parents on side, because as I've illustrated, they can be very anxious about giving more control to the individual themselves. Now, do I have another slide for you? I know I must be using up my time.
Yes, Professor Brown, if you could help us round up, that would be much
right.
appreciated. We really appreciate the insight, but we are actually running over.
Okay, well, with this one, I just commented on lots of this already, but it gives you a list of some of the important things that are involved. You can all have a copy of this, and I would be very happy to talk with you as a whole or with other links if we can find suitable times. And
Sure.
And that would be possible. But I feel very honored that you have invited me to share in your celebrations today. I hope what I've said is useful. I know many of you may know many of these things. I have given some references, and you can see them at the end, but I'm going to send one or two more, which I think might be useful and valuable to you. So thank you very much indeed.
Thank you, Professor Brown. Very valuable insight, very academic, but also extremely valuable, helping us appreciate what the research is telling us. We hope you will still stick around for a few minutes, because after our next performance, we will be opening this up to take questions from the audience. I want to reiterate again that if you do have questions or comments for our speakers, please type them in the chat field and we'll be taking them shortly. But for now, I'll hand back over to Precious to introduce our next performance.
Thank you very much, Mr. Wally. And thank you so much, Mr. Roy, for taking us through that topic and enhancing well-being, a holistic approach to supporting individuals with Down syndrome and their families. All right, moving next on the item is a break and a performance, a recitation by the students. So over to you, Mr. Innocent Okro, for the Deputy Head of Education for this segment. Thank you. Mr. Innocent, take us right away.
Okay, so good afternoon. I am back again. So we'll be having the second presentation of the team of self-advocates. And then to do that, I am going to introduce Solomon Omere for his first presentation.
My name is Solomon Omere. I am self-advocate. I am just like you. Change no to stereotype. Thank you.
So that is Solomon Omere. Solomon Omere is a 31-year-old young adult with Down syndrome. In 2017, he showcased his acting talents as he led the actor in Wale Adenuga's production Super Story, Godwin. Additionally, Solomon Omere represented Nigeria in the basketball at the Special Olympics World Summer Game held in Los Angeles, where he proudly brought home silver medals. Beyond sports and acting, Solomon is also skilled as a barber, baker, and dancer. Over to you, the next speaker, which is Moyo.
My name is Solomon Omere. I am self-advocate. I am human. Just is life. So no to the stereotype. Thank you.
Okay, thank you, Solomon. So Solomon is saying that he is a human just like you. Say no to stereotype. Thank you, Solomon. We're going to have the next speaker, who is Tama Foteta. So over to you, Tama Foteta. Tama Foteta is also a self-advocate at Down Syndrome Foundation Nigeria, who speak for the rights of persons with Down syndrome and for other persons. Over to you, Tama.
Stop discrimination. Say no to stereotypes. Thank you.
Thank you, Tama. Tama is saying, say no to discrimination. Thank you so much, Tama. We're going to have the next presenter and the last for this section, who is Muyo Sore Ejari. Muyo Sore Ejari is a 23-year-old self-advocate that has intellectual disability. In spite of this, he is capable of leading others. Muyo is currently the ambassador for Down Syndrome International. He represents Nigeria at the international level. Muyo is also the leader of the team of self-advocates here at Down Syndrome Foundation Nigeria. Nice meeting you, Muyo, the ambassador. Over to you.
My name is I am ambassador. I represent Nigeria at Down Syndrome International that have from person with means system that have for people with Down syndrome. We are people treat us as people. Thank you.
Thank you so much. Thank you so much, Moyo. So at this point, we will have Mr. Williams Tabe, who is the support person for the team of self-advocates, to quickly give us an insight of what Moyo just said. Over to you, Mr. Williams.
My name is Williams Tabe. I'm a support person for the self-advocate. I'm also a support person for Moyo Sore ambassador in Nigeria and work as fantastic organization. Moyo is that stereotype that people have for persons with intellectual disability. He's trying to tell us that we should stop stereotyping them, that they are people, that we should treat them as people. Thank you very much.
Thank you. At this point, we have come to the end of the second presentation by the team of self-advocates. Over to you, Precious. Thank you.
Thank you so much, Mr. Innocent. And thank you, Down Syndrome Foundation students of Nigeria. Thank you so much for that performance. And one thing I can take home is that we all are humans, no matter what. No wonder Judge Benson was like, I believe that children are our future. Teach them well and let them lead the way. All right, now we'll be having our Q&A, question and answer segment. Please put your questions on the comment sections, and Mr. Wale would pick it up from there and ask the panelists who are rightfully going to take your answers. Please, over to you, Mr. Wale.
Thank you very much, Precious. And as she mentioned, please type in your questions in the chat field and we'll be happy to take them. We will engage our panelists for the next 10 minutes or so. So hopefully we can run through a couple of questions. The first one I have here is from a single mother of a child with Down syndrome. How do I get support for my baby, who I believe I know is a blessing to me, even after the father abandoned and left me with him 14 years ago? So this is potentially another example of the stigmatization and the stereotypes and the discrimination that potentially happens in society with people living with Down syndrome. I was wondering if any of our panelists may want to comment on this question. I'm opening this up to all. Dr. Brown, Professor Brown, would you like to say something?
Yes, thank you. Can you hear me all right?
Yes, loud and clear. Please go ahead.
That's fine. I'm afraid what was just described occurs in every country I've visited. And I've visited many, many countries, about 23 actually. And so this is a real dilemma. What is important is this having happened, that the mother and her child need to have links with other community people with disabilities, needs to have support from a professional point of view, gradually helping them to link into the world generally. Now, obviously, this varies from person to person and need to need. But the major thing is to give support to such a person, as well as her child, to make her realize she has someone who she regards as precious, and I would hope would be part of a group that recognized this was very important. So I don't know to what extent you have this. One would hope there was groups that she could join with her child and get support.
So building a strong support system locally is so important for all. Thank you so much for echoing that sentiment. Ruth, would you like to also chime in on this point, perhaps from your experiences of discrimination? You are muted, so unfortunately we can't hear you. Can you unmute? Thank you.
Thank you, Wale. I want to encourage the young mother to join, at least that is where I belong to, Down Syndrome Foundation Nigeria, if she's not ready. Then if she's there already, we usually have meetings that we are able to speak to each other and to, encourage each other that we are not alone. When you see a mom that has an older child, of course, you know that she has gone through that phase where you are at the moment. She'll be able to, sure you don't stay alone. Just make sure you are not alone. Make sure you don't give in to advices of people that tell you to stay on your own. Because if you stay on your own, you won't get help. But if you join a support group, trust me, when you know that everyone in that group may have gone through or is going through what you are going through, I think from there you pick up, and from there we'll start from there. That's my take.
Thank you very much for that. Maybe the national administrator of the foundation has a few points to add to this as well. So I want to invite Nika Dennis to speak to this as well, very briefly, so we can move on to other questions.
Thank you so much. Thank you so much, Wale. And thank you, Ms. Ruth, for that. You are so right. Down Syndrome Foundation Nigeria, as you know, we are also a resource center, which means that we are available to provide information to you. Even if the child, what we do is we assess children before they attend educational facility. But even if your child is not able to attend, perhaps too young to be in our facility, we do provide resource, we provide guidance, we help to connect you with other parents. As Ms. Ruth had said, there's a parent support group here. They have a strong parent exco group, and they are readily available to help those in need. So I hope that answers your question. We will provide information and details to you after this segment. Thank you.
Thank you very much, Anike, for that. Another question we have is from Olubumi Shosino. Is it possible for us to campaign for specialist hospitals strictly for disabled in Nigeria? Perhaps some smart thinking around that from any of our speakers. Professor Ajuwon, perhaps you may want to chime in on this as well. You're muted. You're still muted. If you can just try again. Yes, we can hear you now. Go ahead, please.
Well, because of the concept of inclusivity that we are promoting, I would say the community hospital with properly trained specialists should be able to accommodate patients with disabilities, including those with Down syndrome. Now, if the person asking the question is concerned about the highly specialized knowledge and skills that are required, then this is where I feel we should increase the knowledge and skills of medical students and nurses, so that as part of their medical or nursing education, they are given, these trainees or these candidates are given robust knowledge and skills, and they are also encouraged to interact with families of children with disabilities, and invite these families, these parents, and these people with disabilities to speak to them during their courses, so that they hear firsthand from people who are directly impacted with any type of disability. That's what I want to contribute to the question.
Thank you very much for that contribution. Very valuable indeed. We have another question here. A scenario, again, speaking to the challenges of a support system. And my child is a dropout, and I am not happy about that. He is very much willing to go to school. And I look forward to getting sponsors from any quarters, either international donors, communities, or governments. And again, this speaks to another challenge, financial support that is required for those living with disabilities and including Down syndrome. Can we have a comment from any of our speakers on this point? I wonder if Adenike is still with us. Perhaps she can chime in. Or Professor Brown, would you like to comment as well?
Yes, I think the points that have just been made, I think, are very critical. And although I don't know your country and I don't know the details, I know that in my journey through life, that it's been very necessary to educate medical practitioners. And I remember a situation where I was given opportunity to talk to a wide range of practitioners and students who are medical, taking medicine. And they did not understand what could be done for people with Down syndrome or disabilities in general. And therefore, we needed to set up, and we did indeed set up, training and orientation for medical students and medical practitioners. Very often, I don't know whether this is true in your country, but for many years, we had many practitioners who in fact did not understand the issues associated with disability. So I'd encourage that. I'd encourage the liaison and the teaching of people who are going to be professionals. Likewise, I think there need to be teaching supports who have been specially trained to work in school environments. It's a generic thing. All these groups who do a variety of things may not know what to do in the condition of Down syndrome and parents. Hope that's helpful.
Thank you very much, Professor Brown. And unfortunately, as we have really run over, I really am under pressure for us to round this up now. So I want to say a big thank you to all our panelists for their valuable contributions, for all the education we've received. And hopefully this has tugged on our hearts as well to make us think about how we can all get involved in making a difference for those living with Down syndrome. So on that note, I'd like to hand over again now to Precious to invite our next speaker as we begin to round up.
Thank you so much, Mr. Wale, for doing justice to all those panels. They were amazing, and most especially to the Q&A session. Thank you so much for that. And thanks to all our panelists who did justice to their topics and questions being asked. Thank you. But before we go, we have the beautiful Mrs. Nike Dennis, who is the National Administrator, Down Syndrome Foundation, Nigeria, for the closing remark. Over to you, Mrs. Nike.
Thank you. Thank you all for joining us today. I'm sure we all had a swell time. It was very insightful and engaging. So as we celebrate World Down Syndrome Day and we champion the theme of ending the stereotypes, I want to say a big thank you to all our esteemed panelists for sharing their insights and experiences. Our moderator, Wale Famurewa, who is an award-winning journalist and a CNBC Africa anchor, and our compare, Miss Precious Destiny, a media presenter. And of course, I want to say thank you to our national president, Mrs. Rose Modi, who was able to join us from afar, for her relentless efforts over the past 23 years in championing the cause and being a voice for persons with Down syndrome. Finally, I thank the entire team, my team members at Down Syndrome Foundation Nigeria, for making this a successful event. Let's continue to embrace, engage, and amplify the voices of individuals with Down syndrome and intellectual disabilities. Together, we can create a world where everyone truly belongs. Keep spreading awareness and advocating for inclusivity. Together, we can make a difference. Goodbye. Until next time, we leave you with this powerful video about showing